fifth edition of the Economic Times Best Healthcare Brands 2022 was held in the national capital to provide a platform for leaders and experts to discuss and deliberate on the issues of shaping the healthcare avenues of the future. The gala event also felicitated the best brands who helped bring healthcare innovation to the forefront. The event started with an address by Vishal Chauhan, Joint Secretary, Ministry of Health and Family Welfare, Government of India.
Today I have been told to talk about the growing health infrastructure of the country, and I was part of some of the discussion. I listened to the discussion, and one of the issues was raised. We are only talking about only 2% of the population, and what are we doing for the rest of the country? So I am probably from the government side. I am going to answer this question. Ayushman Bharat scheme was launched in the year 2017 with two pillars. One was Ayushman Bharat Health and Wellness Centers, and second was Ayushman Bharat PMJAY, Pradhan Mantri Jan Arogya Yojana. Now, two more Ayushman Bharat schemes have been launched. They have been launched in the year 2021. One is Ayushman Bharat Health Infrastructure Mission. And in this, what is coming is that when we talk about the shortfall in our health infrastructure, this scheme is going to address this problem. The total size of the scheme is 64,000 crore over a period of 5 years. And lastly, I will talk about the fourth pillar of the Ayushman Bharat, that is Ayushman Bharat Digital Health Mission. Every citizen of the country have to have a Aabha ID. We call it Aabha ID. Ayushman Bharat Health Account. It's a health ID. We have around 15 portals in our health ministry only. So what this Aabha ID is connecting all the portals together. And what happens is that somebody get referred to a higher center. Then how do we know whether he has reached to the higher center, whether he has taken medicine or not? So when he goes to the higher center, through Aabha ID, he'll get a scan, he will get registered at that higher center. That higher center can be in a government hospital also, can be in a private hospital also. Earlier, people used to carry a bag where, a report, one has to carry that, what is the past history of hypertension, diabetes, what is the X-ray report, what is the, ECG reports. Now it's not required. If it is there in the system, the data will lie in the system where it is. But a private or a government hospital will be given a right to access that data. So that is the kind of integration we are having all over the places. Thank you very much for inviting me for this event. Thanks. I'm grateful to you. Thanks all.
Taking this forward is going to be our next session, a spotlight session on making India the pharmacy of the world. And it is such a delight to have amongst us Dr. Montu Kumar Patel, President, Pharmacy Council of India, a statutory body under Ministry of Health and Family Welfare, Government of India. May I request all of you to please put your hands together and welcome him.
During the pandemic situation, we were supplied all generic molecules to the world, paracetamol, steroids, and vaccines also. So I think India is the pharmacy of the world under the leadership of our Prime Minister Sri Narendra Modi ji, and now told our Heal by India project under the leadership of Honorable Health Minister Dr. Mansukh Mandavia ji. Now they are working how we can supply manpower to the world. How can pharmacists work globally to the world? So we are changing our all course curriculum of the pharmacy because there is a need of hours to change our syllabus accordingly to the match the global standard of the other countries. और आपके ये प्लेटफॉर्म पे मुझे आपके समक्ष बोलने का मौका मिला, इसके लिए आपका सभी लोगों का धन्यवाद. थैंक यू.
A coffee table book titled The Economic Times Best Healthcare Brands 2022 was unveiled during the event. This coffee table book is an effort to recognize the best healthcare brands in India.
Very warm welcome to the Economic Times Best Healthcare Brands 2022.
It was time to recognize and felicitate the excellence in the healthcare sector, and the ceremony started with the felicitation of Kokilaben Ambani Hospital as the Economic Times Best Healthcare Brand 2022.
So data today is defining outcomes and working on patient safety as well. when it comes to safety or when it comes to patient outcomes, data is going to play a very pivotal role. So capturing the data in the right standardized format and making sure that it is available to all stakeholders plays a very, very critical role. So investments in infrastructure and training towards data capture and using this data to improve patient outcomes is critical for us. So when we talk of digitization and innovation, I think the initial steps have been taken. The government was very nimble-footed in terms of putting in the telemedicine guidelines into place. So we need to further adapt and evolve these guidelines to make sure that all medical legal aspects are covered in this. The other important thing is the digital health mission, where standardization of data capture and transmission has to be ensured. And the most important part, of course, is data privacy. How do we make sure that patient data, confidential data, remains within the domains of those who are ideally supposed to access it?
The next brand which bagged the honor was TransAsia Biomedical.
Having learned the importance of diagnostics, in 1979 I founded TransAsia specifically with the goal to bring innovative and affordable diagnostic solutions to India. Even though we became #1 diagnostic company, I was not satisfied because I realized that India was still largely dependent on the imports, especially in the high-tech areas where we in India did not have any technological base. By accident, I came across a R&D center in Europe which was available for sale, and I thought, wow, this could be a great solution. Through this R&D base in Europe and America, we have got many new products which are meeting the needs of India.
Care Hospitals was the next brand which was recognized as the ET Best Healthcare brand.
There is so much of data that is available with the organization, with the hospitals. We've been collecting over the years, but there are data silos available in every area. And putting all this data, integrating it effectively with technology. I mean, let's take an example of e-commerce. I mean, people are expecting that they probably click as less as possible in terms of the clicks on the mouse to get the transaction done. And I think that's exactly the expectation even from the hospitals. Hospitals cannot work from home. I mean, that's simple as that. However, people are expecting that the hospital should come to their home. Now, that's where I think the expectations of the patients and the effective use, intelligent use of the technology, integrating with the current data that is available and putting into a process which is seamless and hence the patient experience.
Next in line was another best brand from Microlabs, and Dolo 650 was being recognized as the ET Best Healthcare Brand 2022.
We feel really privileged and proud to receive this award. Microlabs always has been in forefront in technology to make the medicines affordable. In fact, it is one of our corporate policy statement to make the medicine at affordable prices and accessible to every part of society. Our manufacturing facilities are all ultra modern, in fact state of the art and using latest technology. And our internal communication systems, they're very, very strong, and the intent is there to make our products available at every nook and corner of the country, which was amply shown during the pandemic when our demand for paracetamol and Dolo 650 hit the sky roof, and there was a specific meeting by Health Secretary with all the manufacturing CEOs to develop the production of paracetamol. And we rose up to the occasion and we made Dolo 650 available to every nook and corner of the country in the shortest possible of time. Multi-locational facility and high-speed machines. Also, we quickly made decisions to even be ready with a backup, contract manufacturing facilities. So these things which helped in the peak of pandemic times to make the Dolo 650 available in every part of the country. In fact, there was one dictum by our CMD: whenever a patient wants Dolo 650, wherever he is, it should be available. So we could work on it thanks to the technology, thanks to the ultra-modern facilities we have, and also our communication systems, and across all the departments, starting from the purchase to the quality inspections to manufacturing to the supply chain, distribution, marketing, everybody rolled into action, and we could make it available. So I would say that it is our credo to make the product available to everywhere at an affordable price. That is what we are working with.
Getinge Medical was the next to receive the honour of being the ET Best Healthcare Brand 2022.
Getinge believes in making a difference. During COVID, we helped in saving lives in India with a record number of installations of ventilators and ECMO machines. We also supported hospitals with clinical trainings and technical services. On the innovation front, we have established a Global Innovation Center in Bangalore to develop products catering to both the Indian and global needs. We also feel proud to share about our contribution to the Make in India mission. We manufacture Getinge into a world-class modular operating room system for India and the world.
During the event, a panel discussion was also organized where the industry stalwarts discussed the topic of Eyes on the Future, making India the next healthcare innovation capital. Here are some glimpses from the discussion.
I think the healthcare industry has moved from strength to strength, sometimes slow, sometimes at a very robust pace. But I believe in the last 2 to 3 years, the biggest intervention that has happened has actually been Covid-19. It did two main things. One, it challenged the assumptions of our healthcare delivery system. Two, it's also led to some tectonic shifts and some mega trends that have come through.
Like you rightly touched upon, COVID-19 has asked many questions from the healthcare industry. As far as medical technology, yes, we've always been at the forefront. But in terms of actual use of digitization or digital health, I think providers have been laggards. Pre-pandemic, a hospital like ours or any tertiary healthcare hospital was doing about 2 to 3% of their consults as e-consults. But now, post-pandemic, a good 12 to 15% of our consults have become e-consults. So that is one big change that we've seen. Clearly, what the pandemic has done has accelerated the adoption of digital health.
Things that really get me excited are, number one, there's just tremendous work to do on both on the communicable side, disease standpoint, but also the non-communicable disease standpoint. The demand side of it, in terms of the payers, are also fueling demand, both private as well as public. And then what's fueling demand is infrastructure and that. And then the biggest thing around growth, the confidence in the industry, is the policy part. And I'm seeing that the medical device regulation is creating frameworks that will help provide some stability and will bring discipline to the growth of this industry. So those things get me very excited.
I can say that if we don't invest in innovation during the time of crisis, and if you don't use the technology, then we can't sustain the efforts which we are making. When the COVID pandemic started, you might have seen that we used to import the diagnostic kits, and you see how the challenge was made. But to facilitate that, previously there was only one lab, now we are having 4 labs which can validate the kits. As a result, now we are self-sufficient in diagnostic kits, and the cost of the COVID tests have also come down. It is because of innovation and promotion of the local Make in India concept.
I think if you look at last 2 years from FY21 and now 22, the biggest event, which is COVID, has changed the patient psyche. And I'll probably use the word that it's moving from I need healthcare versus to I want healthcare. I think everything is being driven from there. Growth of healthcare actually is going to be much faster than what we have seen in the past. So that's definitely one thing to probably note.
India has different layers to it. India lives in cities, and a very large part of India lives in a very different part of the country, where you need significant amount of healthcare to be delivered. So accessibility still remains a huge concern. We are also talking about partnering with the government. The PPPs, the COVID times, actually showed a lot of collaboration with the government, and when COVID went away, the entire initiative seems to have died. Now, can we cast the momentum somewhere? Can this initiative be taken forward? What policies are required to be framed together?
Bayer Supradine was also being felicitated as the ET Best Healthcare brand.
The consumer health division of Bayer in India was launched in May 2021 with a vision to make the best healthcare solutions more accessible to the 1.4 billion Indian consumers. We currently provide healthcare solutions to our consumers across pain management, nutrition, derma, and allergy management. With Paradon, we are a market leader in the headache segment, and we are constantly innovating to provide better pain management products and services to our consumers. We have just begun our journey in India, and we will continue to bring more best-in-class solutions.
Next in line was Medica Hospitals, which bagged the honour of being the ET Best Healthcare brand.
So as we know, healthcare is all about accessibility and affordability. Medica has taken a lot of initiatives in this area. Our initiative around e-ICUs and telemedicine, wherein we have actually ensured we run electronically monitored ICUs, which are supervised by our specialists sitting in the Calcutta hospital, into places like Bhagalpur, Munger, and Darbhanga, and a lot of other smaller cities in Siliguri and elsewhere, where we deliver the best quality of care which you can imagine in a town where you wouldn't have that level of specialists available.
The next best healthcare brand was none other than Elements Wellness. The next best brand at the ET Best Healthcare Brands was Ankura Hospitals.
Digital health services is not a novelty term for Ankura Hospitals, but most organizations think of digital as an internal tool for operations and back office applications. We go beyond it and approach digital as a mainstream and accepted clinical tool. We have a hybrid transformation model that implements EMR and artificial intelligence innovatively, not just to collect the data, but to use the data to support and strengthen the patient-physician connection, improve health outcomes, and bring down the overall cost of healthcare.
Zimmer Biomet was the next proud recipient of the honor.
In India, we are focusing on continuum of care by introducing modern suite of integrated digital and robotic technologies with our product offerings, which improve the quality, reduces the cost, and provide quicker access and relief to both patients and providers. With 90 years of proven expertise, Zimmer Biomet is positioned to deliver high-quality solutions. Our focus continuously has been on patient outcome and reducing the cost of long-term disease management. This can be achieved through reducing the duration of hospital stay, early intervention of the disease, and by providing data insights to aid healthcare providers to ensure that the patients get the treatment best suited for them.
The next best brand at the ET Best Healthcare Brands was Sinochem Pharmaceuticals.
Sinochem has initiated development of new formulations with the use of new platform technologies and cost-efficient inputs. Further, Sinochem focuses on the following. First, the new product development that we do is through collaboration with various organizations and institutions, which results in optimum investment. Secondly, backward integration wherever possible. We also have long-term tie-up with vendors and clients to ensure uninterrupted supplies of inputs and ensure long-term continuity of business.
Next in line was Max Healthcare, which was recognized and felicitated as the ET Best Healthcare Brand 2022.
At Max Healthcare, we strongly believe that digital healthcare has the potential to disrupt the way healthcare is imparted and sought. And we continue to invest in technologies that will help us in our mission to be the best healthcare provider in the country. For us, this is a sustained investment, and we are building a platform that our doctors can use to provide better care and our patients can use to gain access to healthcare 24/7. We also strongly believe in the power of data and in investing heavily in AI and ML to provide more timely and personalized care, paving the path to deliver better patient outcomes.
Pure Nutrition was the next brand which bagged the honor.
Today, our concentration is more on treatment rather than on prevention. Pure Nutrition produces products which are of natural extracts, and our products have got a very high bioavailability and a bioefficiency. We also have clinical research products such as omega 3, 5, 6, 7, 9, which is a variant of 5 vegan omegas all put into one capsule. This was our first experience because we have never had this type of experience, and we feel very rejuvenated as a team. And the whole team of our company, we have close to 100 people working in the organization, and they are very excited when this award was announced in our name, and this will definitely motivate our team to achieve greater heights.
The next best brand felicitated was Candid Powder.
Our aim is to enhance the well-being of consumer by providing innovative healthcare solutions, especially in skincare as well as in hair care segments. The objective is to provide the science-based products to the consumer. Candid Dusting Powder is undisputed leader in the category in the antifungal powder segments, and it has been switched from prescription to OTC in 2015, and since then it has grown at a CAGR of almost 20%, and it has also enjoyed the trust of the doctors during the same period.
Finally, last but certainly not the least was Mars Liva Medicity Palai.
Mars Liva Medicity Palai is giving high priority for the transparency in medical care, and also qualified frontline professionals are required for the medical setup in India. Good infrastructure should be provided in all hospitals, and affordable treatment should be given to the common people also. Government subsidy is to be provided for the lower sections of the community.
The 5th edition of the Economic Times Best Healthcare Brands culminated on a very positive note. The healthcare sector in India is on the growth path, and the hunt for excellence in the healthcare sector by the Economic Times will go on.